there, my name is Michelle. I have had a lot of experience with the Peer Health Advocacy Training Program. I have facilitated it, coordinated it a few times over the years at Peers Victoria. I also work at Peers Victoria right now, and I have some experience in the sex industry. Today, I'm super excited to be here to talk to you about one of the foundations of this program, and that is, what does being an advocate mean? What does advocacy mean? And we're going to touch on how to be a good advocate. So let's get started with, when you hear the word advocacy, what does that mean to you? What comes up for you? Let's just take a moment to think about it and to brainstorm with the group. So some of the things that people have said in the past is that it is someone who can help you, someone who can stick up for you, support you, someone who will listen to you. Maybe it's somebody who can hold space for you so you can figure out what you need. So that might mean like literally spending time with you so you can figure out what you need, or it might mean, kind of more symbolically being that person in your life that you can bounce ideas off of. It could be, a lot of people say it's somebody who has information or experience or resources that you need. Someone who can speak up for you when you can't do that for yourself, and someone who understands what you need. Next, I want to talk about a time when you had an advocate in your life. So that may have been in a formalized way. So you may have had a worker, a support worker, a social worker, a counselor, somebody who was advocating for you. Or it may have been a little less formal, peer advocate, or even a friend or a family member who was helping you out with something. So in that case, I just want you to think about a time when it really worked, either with that person or with that situation. And when you think about that, the time when this advocacy really worked for you, what was going on? What was happening? What made it so positive, or what made it helpful? Let's think about that, brainstorm, and share it with each other. So what some people have shared with me about this is that the person listened, that they were a good listener, that they had time for you, they made time for you, that they followed your lead and listened to what you wanted, that they didn't judge you and that you didn't feel judged, and that they had some experience or resources and they understood what was going on for you and they were able to help you with that because they had those experiences or resources, that they were compassionate and understanding, and that they were empathic or had empathy for you. I want to just expand on this a little bit because there is kind of a distinction between someone having empathy for you or having empathy versus maybe having sympathy or feeling sympathy for you. If someone is feeling empathy for you, they are trying to understand what it's like to be in your situation. It's like they want to walk a mile in your shoes. So they are thinking about that and looking at your perspective, versus somebody who's feeling sympathy for you is more likely, oh, poor you, that's terrible that happened for you. Sometimes that's okay. I mean, we are going to feel badly for somebody, but for the most part, we want to try to understand someone's experience as opposed to just feeling bad for them. So often someone feeling sympathy for you is not going to be all that helpful. Those were some of the things that people have shared about when it worked well for them. Next, I want to talk about and think about when maybe it didn't work well. So this could have been with the same person, the same situation, or often it was with a different situation or a different person. So the flip side is, sometimes when it didn't work well, people did feel judged, or the person who was in the role of advocacy for them did something that they didn't want them to do. Maybe they even made a report, or they reached out to someone, or they shared something, and you didn't want that, or the person didn't want that. Maybe they assumed that their experience that they'd had with it was the same as yours, but it actually wasn't, and so that was a disconnect. Maybe they talked too much about themselves, or they spent time talking about what it would be like for them. Having empathy is one thing, but making the situation about yourself is not helpful. If you are reaching out or you're wanting to have someone advocate for you, you don't want them to be making the situation about themselves. And horribly, and unfortunately this does happen, but maybe they didn't keep your confidence, maybe they shared something with somebody that you didn't want shared, and that could be hurtful or it could be devastating. Maybe they tried to rescue you. That's another thing that happens sometimes when people feel like they're in the role of advocacy. They're really trying to rescue people. For the most part, people don't want to be rescued. They want to be heard and seen, but they don't want to be rescued. They want you to listen to them so that you can figure out what they need and want, and you can go down the path that they want to go down. So if you think about the times when you've had an advocate in your life and what worked and didn't work, this is a really easy and helpful way to help you decide how you're going to be an advocate and how that's going to work for you. And to think about those things as you're having interactions with people, really to think about what would I want or need if I was in that situation, what has helped me in the past. So some of the key points in summing this up would be to remember it's about them and not about you. So this is important at so many levels. Obviously, it's not going to be a good experience for somebody if you're thinking about it that it's about you, but you also just need to have those boundaries and understand those lines. So if it feels like it's about you, or if it's bringing things up for you, you might need to pass that on to another person, or get some additional help, or just not be able to be the advocate, for them in that moment. On a similar vein, you need to know yourself and know your limits. There's going to be some things that are just not comfortable or appropriate or okay for you to support someone around. Maybe it's too fresh for you. Maybe you had an experience that was very painful or upsetting, or maybe there's just many reasons. And so in that case, you're going to learn more about that in the course, but you're not going to want to be supporting somebody that passed your limits or comfort level. You don't need to be an expert to be a good advocate, but it is important to have your toolbox full of things. So part of what's happening with this program is you're learning skills, you are learning about resources, you're gaining knowledge and experience that you can then use to support and help other people. So you don't need to be an expert, but it's good to have those skills and those resources. Most people want to be seen and heard. So being a good listener is really key. And again, you're going to learn a little bit more about that during this course, but it's something to really think about, how to be a good listener. There's lots of information out there about listening skills, and really to focus on that. That's one of the most important things. To understand and practice confidentiality. Again, this is kind of complicated sometimes and nuanced, but the most simple thing is you do not want to be sharing information that anybody told you with anybody without their permission. So that is a quick recap of kind of the points around being an advocate and what it looks like, how you are in a role of supporting somebody, listening to them, maybe speaking for them, but that you have limits and boundaries and confidence and confidentiality around that, and you need to know and understand yourself. And then you're also going to be filling up your toolbox with resources that you have so that you can share those and help other people out with the knowledge and skills that you have. Enjoy the rest of your training. It was great being here today. Take care. Bye-bye.